The Leprosy Mission Trust India, founded in 1874, is the largest leprosy-focused NGO in India. We work with people affected by leprosy and other neglected tropical diseases, NTDs, people with disabilities and marginalized communities. Leprosy is an ancient, infectious, neglected tropical disease with multidimensional consequences. Researchers believe that leprosy has existed since 4000 BC. A potentially crippling disease, leprosy affects millions even today, trapping them in poverty, disability, and social exclusion. There are many myths associated with leprosy, evolved through centuries, and because of this, there is a strong, deep-rooted stigma attached to the disease. The stigma attached to leprosy creates barriers to early diagnosis and treatment of leprosy patients. Leprosy, if not diagnosed and treated early, can cause nerve damage, resulting in irreversible loss of sensation in hands, feet, and eyes. This is followed by loss of muscle function and paralysis affecting hands, feet, and eyes, which can lead to permanent disabilities. Because of the strong stigma attached to the disease, the affected persons, even after they are cured, are excluded from the society. Their hardships are many, ranging from medical, social, psychological, to economic and legal. Now, let's see some of the latest statistics about leprosy. WHO's report says that in 2015, a total of 211,973 new leprosy cases were reported from 108 countries worldwide. Data from Government of India's National Leprosy Eradication Program shows that 1,27,334 new leprosy cases were detected in India during 2015-16. We have made significant contributions in bringing about positive change in the lives of people affected by leprosy. Throughout our existence of over 140 years, we have addressed the needs of tens of thousands of people affected by leprosy through our programs, namely healthcare, sustainable livelihood, community empowerment, advocacy, and research and training being implemented through 14 hospitals, 6 vocational training centers, 5 residential care homes for elderly people affected by leprosy, and a research lab spread across 9 states of India. Through our healthcare program, we provide specialized leprosy care to persons affected by leprosy and health care to the general public in various medical specialities. The program is implemented through 14 hospitals and a clinic spread across 9 states. Sustainable Livelihood Program provides institutional-based, job-oriented, technical and employment opportunities to young boys and girls affected by leprosy and disability through 6 vocational training centers spread across 6 states. We also provide community-based vocational training to marginalized women and girls from rural communities. Through Community Empowerment Program, we work with persons and communities marginalized due to leprosy, disability, gender, and poverty. We aim to bring about the economic development and social inclusion through activities such as awareness raising on health, human rights, social issues, and skill building for sustainable livelihood. Apart from the 14 hospitals and 6 vocational training centers, the program is implemented through 8 community empowerment projects spread across 8 states. Through our advocacy program, we address the development needs of people affected by leprosy through a rights-based approach. We engage with various ministries and departments of the central and the state governments for creating an enabling policy and legislative environment for people affected by leprosy to live as equal citizens of the country. Now, about research and training program. Through the multidisciplinary and multi-center research carried out in the laboratory, hospitals, and the field, we generate evidence-based knowledge in immunology, molecular biology, clinical, social, and operational aspects of leprosy to eradicate the cause and consequence of leprosy. With the aim of developing and retaining expertise in leprosy and other entities, WASH, and disability, we build the capacity of our external stakeholders and also our staff. In the last 5 years, that is from 2012 to 16, our programs have benefited more than 3.2 million patients, equipped more than 5,600 people with livelihood skills, provided financial assistance for education to more than 8,700 students affected by leprosy, disability, and have empowered more than 2.2 million people through community development interventions. The Leprosy Mission Trust India's strategic engagement with policymakers in 2014 and 15 resulted in the Law Commission of India submitting its report 256 called Eliminating Discrimination Against Persons Affected by Leprosy to the Government of India. Along with its report and recommendations on the issue, the Law Commission has prepared a model draft legislation called Eliminating Discrimination Against Persons Affected by Leprosy, the ETPAL Bill 2015. This draft law contains principles of non-discrimination and equal protection before the law that must be guaranteed to all persons affected by leprosy or members of the family. It also seeks to promote the social inclusion of persons affected by leprosy and their family members through affirmative action. We believe that through perseverance and concerted effort, we can bring healing, inclusion, and dignity in the lives of people affected by leprosy and realize our vision of people affected by leprosy living with dignity in a transformed, inclusive society that has overcome leprosy.